menstrual cycle. So there are 3 phases of the menstrual cycle. 2 of those phases coincide with the follicular phase of the ovarian cycle. So the menstrual phase and the proliferative phase coincide with the follicular phase of the ovarian cycle. Whereas the secretory phase of the uterine cycle coincides with the luteal phase of the ovarian cycle. So once again, we have 2 different cycles. The uterine cycle, what's happening in the uterus. The ovarian cycle, what's happening in the ovaries. And they're basically 2 perspectives of the same sequence of events. So we can consider the events that take place in the follicular phase as coinciding in time with the events that are taking place in the menstrual and the proliferative phase. So the menstrual phase is basically the shedding of the uterine lining. This is where blood flow to the tissues starts to decrease. This is if fertilization does not take place, so the tissues begin to die off, and we have the actual menstrual flow through the vagina. So this is the bleeding that happens each month if there is no fertilization of the oocyte. This is under the influence of hormones. This is triggered by the drop in the levels of estrogen and progesterone. Obviously, if we don't have implantation, we don't have the sustaining of the corpus luteum, and so there is no sustenance, there's no takeover of the hormone production, so those hormone levels drop, and then menstruation is triggered. This is when the corpus luteum degenerates. The proliferative phase, which is phase or days 5 through 14, is where the uterus prepares for fertilization. So this is where a new lining begins to grow. We've got growth of the glands, we've got thickening of the smooth muscle layer of the uterus, we've got blood vessels beginning to grow, and we can see here, days 6 through 14, this is where the uterus begins to prepare for another fertilized egg to implant. Again, this is under the influence of hormones, estrogen, which prepare the uterine lining by thickening up the smooth muscle layer, increasing the size of the glands here, increasing the lining that's present, preparing for implantation. And then finally, the secretory phase is where the uterine lining is at its thickest. This is where we should ideally see implantation happen. The endometrium is fully prepared to accept a fertilized egg at this point. We've got the glands secreting secretions that are rich in glycogen to supply the energy that's needed for the fertilized egg. Initially, we also see increase in cervical mucus secretion, which creates this mucus plug, which prevents any new spermatozoa from coming into the reproductive tract, preventing any pathogens or bacteria from also entering the reproductive tract, and creating this environment where that oocyte can implant successfully and begin the first part of a pregnancy. So someone is asking if there's shedding of the lining when you're on birth control. And that's a really interesting question. So there isn't shedding of the lining when you're under the influence of birth control. And that is because the hormones are influenced. So we don't have the levels of hormones that are required to produce the thickening of the endometrial lining, the thickening of the glands and the blood vessels, etc. These do not have the hormones, right? Because birth control alters your hormone levels, especially estrogen, so you don't ovulate a mature oocyte normally, and you don't prepare the uterus for implantation. So you don't have these events taking place if you're under the influence of the hormones in birth control. Okay, that's a really good question. So here is a summary of the 2 phases of the ovarian cycle and how they coincide with the 3 phases of the uterine cycle. So we've got the follicular phase, day 1 to 14, which is really preparing that Graafian follicle and preparing the oocyte to be ruptured and preparing for ovulation. That is coinciding with the first 14 days of the uterine cycle, which has the menstrual phase of bleeding, as well as the proliferative phase, which is preparation for implantation as well. And then we can look at the final phase, the luteal phase of the ovarian cycle, which is where we have a rupture of that oocyte, and then we have the corpus luteum taking over the hormone production. And that is coinciding with the secretory phase of the uterine cycle, which is where the uterine lining is thick, it's white, it's in its most developed state in preparation for successful implantation of the fertilized oocyte. Okay. So here's how the hormones kind of change over the course of the uterine cycle. We've got estrogen really high in the first part of the cycle. That triggers this surge in luteinizing hormone, which results in ovulation. And then towards the end of the uterine cycle, we've got both progesterone and estrogen really high, and that is keeping the lining, developing the lining to prepare for implantation. We also want to point out that LH and FSH are under the influence of these hormones. So when these hormones drop off, they will eventually send a negative feedback loop up to the pituitary so that the levels of LH and FSH will decrease. And this happens again and again each month in order to bring about the events of the menstrual cycle. Okay, so that's all we'll look at for today. I'm going to go back here quickly. We're going to talk about these checkpoint questions. And I don't know if we have enough time for the practice questions. So what I'll do is I'll post this PowerPoint, which has a few practice questions for you to look at on your own. So these were the checkpoint questions from the reproductive packet 1, and we'll kind of go through these here. So the first one is for each of the following descriptions, indicate whether it applies to Sertoli cells or to Leydig cells. Remember, we described Leydig cells as being the interstitial cells of the testes, whereas Sertoli cells were the actual cells that line the seminiferous tubules. So are part of the, are present in the seminiferous tubules, that's going to be Sertoli cells. Are present outside of the seminiferous tubules, these are going to be Leydig cells. Secrete testosterone, those are going to be your Leydig cells. Are the target cells for FSH, that's Sertoli cells. Are the target cells for LH, that's Leydig cells. And then secrete inhibin, that is Sertoli cells, okay? So make sure you have a good understanding of what the Leydig cells do and where they're located, what the Sertoli cells do and where they're located as well. Question 2 here, arrange the following structures so that they correctly describe the path of sperm transport from the testis to the penis. So the correct series of structures is from the seminiferous tubules. So we know that the development of sperm happens from the basement membrane of these Sertoli cells all the way to the luminal surface of the Sertoli cells. They enter the seminiferous tubule, then they make their way to the rete testis, then to the efferent ductule, this should be ductule, not ductile, ductule, and then to the epididymis of the testes, then into the vas deferens, to the ejaculatory duct, and finally to the urethra. And then the final question here, describe the role of the autonomic nervous system in the male sexual response. We talked about this at length today. We've got erection, parasympathetic system, emission, sympathetic system, ejaculation, sympathetic system, okay? Yeah, so I'll pause here to see if there are any questions. We're not going to go any further in the female reproductive system, so the regulation, because it just doesn't make sense. It's going to be way too much for you guys to feasibly study in preparation for next week. And I want you to be able to focus on what we did study in enough detail to do well on the final exam. So the final exam will only have material from the GI system, material from the male reproductive system, and then the first objective from the female reproductive packet.